Good morning, Dr. Eric here, Fanwood Back Relief Center. Today in this health video, we're going to talk about conditions that can be mistaken or mimic carpal tunnel syndrome. Carpal tunnel syndrome can be a very painful condition where the median nerve that passes through the carpal tunnel here, along with other nerves, blood vessels, ligaments, tendons, all in this area gets really bundled up, and when it gets overused or injured, it can cause inflammation in that area, it can cause pain across the wrist, tingling, numbness in the fingers, weakness in the hands. All this stuff can occur through overuse. Some overuse could be typing all day, using your phone, video games, doing something as part of your job or hobby where you're constantly using your hands and your wrists and your fingers, overusing them. Also, injuries to this area, falling on the wrist can also cause that area to get inflamed and irritate the median nerve that passes through here. Now, the median nerve runs right through here, through the carpal tunnel here, and supplies innervation with the thumb, this finger, and half of this finger. So typically when patients come in and they have pain or numbness or tingling in these three fingers, we know that the median nerve is at play here. But there's also certain conditions that can mimic the overall symptoms of pain, numbness and tingling, discomfort in the hands and the fingers and the wrist. And we're going to go over a few of those. First of all, ulnar nerve entrapment. The ulnar nerve, which leaves from the lower part of the neck here and runs through the shoulder and the elbow, supplies these fingers with innervation. So we're talking the pinky, the ring finger, and actually half of the ring finger here. So the ulnar nerve can cause, any disruption of that nerve can cause these symptoms in the hands as well. So we look for pain along this side of the arm or elbow. Not to be overlooked is any condition that can irritate or pinch the nerves in the neck, the shoulder, elbow, or wrist. We want to assess the whole area. That's when somebody comes in with carpal tunnel symptoms, we want to check the whole area. Back to other nerves, other conditions that can mimic it. Radial nerve entrapment. The radial nerve runs on the outside of the forearm here, and that nerve can also get inflamed through overuse and mimic the same kind of symptoms. Brachial plexus injury. So there's a network of nerves from the lower cervical from C5 to T1, which is called the brachial plexus. And these nerve roots can get irritated through injury to the neck, the shoulder, the upper extremities. So we want to make sure that there's any irritation on those nerves in the brachial plexus, that we remove that irritation so there can be proper function down into the arm and the hand. So ulnar nerve entrapment, radial nerve entrapment, brachial plexus injury, injuries to the cervical spine, disc injuries in the neck, sprain strain injuries of the neck, of the upper trap, shoulder. There's a lot of different things that play here, so we always check all the way from head all the way down to toe to make sure things are, number one, in their best alignment. Okay, because if something's out of place, it can irritate and cause disruption of the nerves, of the muscles, of the tendons, of the ligaments. The second thing is we want to make sure things are moving properly, no restrictions in the joints in the neck. Make sure the shoulder's gliding properly, the wrist, carpal bones are moving properly, because any fixations in that area can also stir up that inflammation and cause the similar symptoms. Bottom line, we need to check, we gotta look at the whole picture. We can't just isolate on the area of the wrist and treat the patient just by those symptoms. To me, that's just not the best approach. We wanna look at the whole area to make sure nothing is irritated, nothing's out of place, everything's functioning as it should. Any questions about this, let me know. If you're suffering with any of these symptoms of the wrist, of the hand, of the fingers, we'd gladly be able to help you out, point you in the right direction. If it's something that we can't treat here, but a lot of the cases we can treat through the use of chiropractic care, different therapies, stretching, exercise, diet modification, supplements we can recommend for the inflammation on those tissues as well. That's all we got today, guys. Hopefully you have a great week, and we will talk to you next time. So long.